Today we have Dr. Hana Kahleova, who is both a medical doctor and a PhD in nutrition and diabetes. So she's the director of the clinical research at the PCRM. I'm sure you recognize her from the Exam Room Live podcast. You give such a wonderful presentation and a practical means of understanding your research that I really appreciate. And I'm sure many viewers do. She has carried out dozens of research studies focusing on metabolism, fitness, mental health, insulin function, as well as body weight, among other things. You had such a breadth of research out there. Some of her most recent published articles focused on investigating the effects of a plant-based diet on the metabolic response in overweight participants, the effects of a low-fat vegan diet on both body weight, insulin sensitivity, but also other biomarkers involved in overweight participants, and the impact of intermittent fasting and time-restricted eating on metabolism. Today, Hana is here to graciously share how we can optimize our diet to boost our metabolism based on what she has found in her research. I understand you have a presentation for us today, Dr. Hana?
Thank you so much for the wonderful intro, Karli. Yeah, that's right. It's really my pleasure to be here with you and to share this vitally important information. And let me share my screen and start my presentation. So we'll be exploring one of the most practical aspects of health, one of the most important topics we have in life, and that's how to optimize your diet to boost metabolism. Does anyone have the experience that when you were in your 20s, you were able to eat anything you wanted without gaining weight? And yet, a few decades later, you seem to be gaining weight from just breathing air. And that struggle is real for many people. Unfortunately, excuses do not burn any calories. I wish they did, but they don't. So we better look at the science. In addition to the classical energy balance, we'll be covering four main aspects of nutrition today. Number one, meal timing. That means we'll explore whether eating meals at certain times of the day is better than eating them at other times. Number two, how many meals should we eat each day? Are snacks good for you, or should you eat fewer meals? Number three, is it important to eat your meals at regular or consistent times? And number four, what should you eat if you want to boost your metabolism? So let's dive into this. Let's start with our topic number one. When should we eat? When is the best time to eat our meals? Meal timing has been shown to be important for our circadian rhythms and metabolism. If you eat the same meal in the morning and in the evening, the metabolic effects will be different, and you will deposit more fat from the meal when you eat it in the evening. People who usually eat breakfast are leaner than those who skip breakfast, and that's despite a larger caloric intake usually in breakfast eaters. In one interventional trial, it was a weight loss trial that lasted almost 6 months and had 420 people. The researchers looked at the timing of their meals. And so all the people had the same diet composition and the same caloric intake. But some people started eating their meals earlier in the day and also finished eating earlier, while others were late eaters. And the late eaters were losing less weight with the same diet than those who were early eaters. So that just shows us the importance of meal timing. Data from the Health Professionals Follow-Up Study that included more than 29,000 US men showed that men who skipped breakfast at least once a week had a 20 to 39% higher risk of developing type 2 diabetes compared with men who ate breakfast every single day. When the researchers looked at breakfast and meal frequency, there were four groups: eating breakfast, yes or no, and eating 1 to 3 meals a day, and eating 4 to 7 meals a day. So eating breakfast and eating 1 to 3 meals a day is a reference group. Which group do you think was the worst off? Well, bingo, it was the one that was skipping breakfast and was snacking, was eating 4 to 7 times a day. Their risk of developing diabetes was basically doubled compared to the ones who were eating breakfast regularly and eating 1 to 3 meals a day. Breakfast is important for glycemic control also in people with type 2 diabetes. When people with type 2 diabetes eat breakfast, their mean blood sugar level is 20% lower during the whole day compared with skipping breakfast. And also their insulin is secreted in a better way. The insulin levels were 20% higher when eating breakfast. So it looks like we should definitely eat breakfast every single day, right? But what if you don't feel hungry for breakfast? Well, my next question is, what did you have for dinner? I bet it was all delicious, but maybe it was just too much food. So next time, try to make your dinner really light, and extra points if you'd like to skip your dinner, because then you will feel hungry in the morning and you will be looking forward to eating your breakfast. And that thought inspired us to conduct a randomized clinical trial where we compared the usual 6 meals a day plan for people with type 2 diabetes with only eating breakfast and lunch, only 2 meals a day. The diet composition was the same, the calories were the same, and each participant went through each intervention. So in a random order, the participants started with either 6 meals a day or 2 meals a day for 12 weeks. And then they crossed over to the opposite intervention for another 12 weeks. So each participant had exact data for themselves. We didn't find out only what worked for the whole group, but also for each individual. So let me show you the findings. The findings are shown as changes from baseline on 6 meals a day, A6, versus 2 meals a day, B2. And if the columns are going down, it's a decrease. If they're going up, it's an increase. So we can see that the participants lost weight on both interventions, but they lost more weight on 2 meals a day. The same was true about liver fat. They lost more liver fat on 2 meals a day. Their insulin sensitivity improved more on 2 meals a day. The HbA1c, a marker of long-term glycemic control, improved about the same on both regimens. Fasting plasma glucose and fasting insulin decreased more on 2 meals a day, which is a positive finding. And what's really interesting is that also the depression symptoms decreased more on 2 meals a day, and even feelings of hunger decreased more on 2 meals a day, which may be really surprising to many people, even for the participants themselves. When they were joining the study, many of them were like, I can do the 6 meals a day easily, but I'm not sure about the 2 meals a day. I bet I'll be starving. And they were really surprised by their experience. They liked the 2 meals a day plan so much that many of them decided to stick for it for life. One of my patients contacted me during COVID when he had gained some weight. And I told him about the study on 2 meals a day. And he was like, well, that sounds good. Let me just eat whatever I'm eating. I will not be changing what I'm eating, but I will just switch to 2 meals a day. I'll eat breakfast and lunch. And in 8 weeks, he lost 22 pounds by just paying attention to the right meal timing. And before the oldest man on earth died at the age of 114, Walter Bruining attributed his longevity to eating just 2 meals a day and working as long as he could and always embracing change. He even invested in stock market when he was 105. So what an inspiration. 2 meals a day may prolong your life by aligning the circadian rhythms through the eating and fasting cycle. Moving on to our next question. How many meals per day should we eat? We kind of touched on it in the previous section. This study where people were eating only 2 meals a day is kind of striking, and it's kind of counterintuitive. So let's see what the science says about snacks. Snacking has been suggested as one of the strategies how to keep your weight off and how to regulate your blood sugar if you're diabetic. But eating more than 3 meals a day has been shown to increase the energy intake and also increase the risk of obesity and type 2 diabetes. Snacking increases the food stimuli, hunger, and desire to eat. So when we're looking at meal frequency and the risk of diabetes, those who were eating 4 to 5 times a day, that means they were snacking, they increased their risk of developing diabetes by 4 to 18% compared with those who were eating 3 meals a day. I think this is a fascinating topic, and I decided to study it in more detail in one of the blue zones where people live the longest and are healthiest on Earth, in Loma Linda, California. Loma Linda is famous for having the most centenarians. People live to at least 100 years old out of the whole United States, and it's one of the places where with the most centenarians in the whole world as well. I analyzed the data from more than 50,000 participants in the Adventist Health Study 2, and I looked at meal timing and frequency and how people were gaining weight over the follow-up of more than 7 years. What we found out was really fascinating. We found a linear relationship between the number of meals and snacks eaten per day and how people were gaining or losing weight. So when eating 3 meals a day is a reference group, then snacking, eating 4 or more meals a day, was associated with weight gain compared with those who were eating 3 meals a day. And what's fascinating, there was a group of people who were eating only 2 meals a day, and they were better off in terms of their weight management than people who were eating 3 meals a day. They were actually eating 2 meals a day was associated with a better weight management and a relative weight loss compared to those who were eating 3 meals a day. Now, what about consumption of breakfast? Consumption of breakfast was protective against gaining weight. And what also mattered was the timing of the largest meal. Eating breakfast as the largest meal was the best out of all the options. These people had a better weight management compared to those who were eating their largest meal for lunch or for dinner. And also the length of night fast was an important factor. The best was having the night fast 18 hours long, which brings us back to eating 2 meals a day, about 5 to 6 hours apart. So here you have it, breakfast, lunch, and dinner. These findings suggest that we should eat breakfast like a king, lunch like a prince, and dinner like a pauper. So if you'd like to skip dinner, at least sometimes, you get extra points and extra metabolic benefits. Moving on to the third topic, which is the regularity in meals. Should we eat meals at regular or consistent times, or does it even matter? To answer that question, there are a few studies on this topic. One Swedish study with 3,600 adults found out that regular eaters were really leaner, and they had a 37% lower risk of developing metabolic syndrome compared with adults who were eating at chaotic or irregular times. Another observational study in 1,600 middle-aged adults found out that those who were eating breakfast at irregular times had a 34% increased risk of developing metabolic syndrome. And is it only about breakfast, or does it apply to lunches and snacks? Well, I'm glad you asked, because a prospective British study in 4,300 adults found out that irregular lunch was associated with a 42% increased risk of metabolic syndrome, and irregular snacks with a 35% increased risk of metabolic syndrome. So it really pays off to eat meals at regular times or consistent times. That means if eating breakfast at 7, roughly at 7 works for you, that means you can have it at 10 to 7, but also 15 after 7. You don't have to have it at 7:00. But roughly at the same time is really beneficial for our metabolic health. Now, the fourth question we like to answer in this lecture is, what should we eat to boost our metabolism? Well, this topic seems to be a jungle. The headlines are advocating for different diets, and it looks like we need a direct comparison between these dietary patterns in order to decide which one works best. So, is it the keto or the Mediterranean or the vegan diet? Who knows? Let's explore. We need a head-to-head comparison to answer that question. So let's start with a head-to-head comparison between keto and vegan. One study conducted by Kevin Hall, which was a ward study. That means that the participants came in and spent a month in a metabolic ward, and they didn't go outside. There was a complete control over what they ate, how many calories they were burning. This study compared 2 weeks of a keto diet versus 2 weeks of a low-fat vegan diet. And the participants tried both in a random order. One group started with the keto diet and switched over to the vegan, and the other group started with the vegan and switched over to the keto diet. Now, the keto diet contained 75% calories in the form of fat and only 10% carbohydrates. And for the vegan diet, it was the opposite. 75% of carbohydrates and only 10% of fat. The energy intake really decreased on the vegan diet by about 700 calories per day, which sets the participants up for continued weight loss compared to the keto diet. Now, the body weight change was fascinating. It looked like in the first week on the keto diet, the weight loss was much more faster, but the participants were not losing much weight in the following week. On the vegan diet, the weight loss seems to be slower, but steady. Now, the question is, what did the participants lose? Was it really the fat they needed to lose? The answer is, on a vegan diet, absolutely. People were losing the fat they needed to lose. However, on the keto diet, the fat didn't really move. So what does it tell us? That means that the muscle loss was responsible for the weight loss on a keto diet. Who wants to lose muscle? No, we don't. So a vegan diet was definitely a healthier way how to lose weight. Now, moving on to the next question. Which one is better? Is it Mediterranean or vegan? In order to answer that question, we conducted a randomized crossover trial where the participants were for 16 weeks on a Mediterranean or on a vegan diet. And after 16 weeks, they crossed over to the opposite diet. What did we find out? The vegan diet was much better, not only for weight loss, but also for other cardiometabolic outcomes, such as blood lipids, and also their blood sugar, and the body composition. So it seems like the vegan diet was a better choice. We often think about weight loss in terms of energy intake and energy expenditure. So sometimes people think, in order to lose weight, I just need to reduce the energy intake. And they don't think much about energy expenditure, or they think about it in terms of exercise. But can a diet actually affect the energy expenditure? What if we ate as many calories as we wanted and we would just burn the extra energy in the form of heat? Does it sound like science fiction? Well, let's see. Let's explore. About 70% of all the calories that we're burning on a day is due to basal metabolic rate. About 20% are due to physical activity, and the 10 remaining percent are due to the thermic effect of food. That's the heat, the release of energy in the form of heat once you eat a meal. You know it from your practical experience. When it's really cold, on cold days, you're looking forward to eating your meal because you will warm up because of the thermic effect of food. So when we eat a meal, there's this thermic effect of food, the release of energy in the form of heat. Now, obese people have a lower thermic effect of food compared to lean people. Instead of, for lean people, the thermic effect of food may be about 15% of their energy expenditure, and for obese people, it may be only 9%. So that's significantly reduced. Now, is it due to insulin resistance, or is it due their fat mass? It turns out that it's both. One study looked at the effect of insulin resistance. So people who are insulin resistant have a lower thermic effect of food. And also people who just have more fat and are obese have a lower thermic effect of food. Now, what about the composition of the diet? Does it play a role in the thermic effect of food? Absolutely. When you eat a high-fat meal, 70% of calories in the form of fat, the thermic effect of food will be much lower, 32% lower, compared with a low-fat meal, which has only 20% of energy in the form of fat. So the quantity of fat in your diet really plays a role, and you want to keep your diet low in fat in order to burn more calories. What about the fat composition, the fat quality? That plays a role as well. The saturated fatty acids contained mainly in animal foods, but also in coconut oil and in palm oil, those meals will be burning less calories after the meal compared with polyunsaturated and monounsaturated fatty acids that are found in nuts and seeds and other plant foods. Also, the food processing plays a major role. When people were eating sandwiches from white bread, the thermic effect of food was lower compared to a whole grain sandwich. So you want to be also careful about eating foods that are minimally processed, which will be beneficial for burning more calories. So since a plant-based diet combines all of these aspects, it's low in fat, very low in saturated fat, and favors the consumption of unprocessed foods. Can you see any difference in the thermic effect of food if you go vegan? Absolutely. Dr. Barnard was the first one to show that a plant-based diet can increase the after meal calorie burn by 16%. And we conducted a randomized clinical trial that lasted 16 weeks. And we put people either on a low-fat vegan diet that consisted of fruits and vegetables and grains and legumes, or they stayed on their usual diet for 16 weeks. We measured their metabolism using indirect calorimetry. which is like a spaceship. We put a clear hood over your head and you breathe normally. And we measure the carbon dioxide output. And based on that, we're able to calculate how many calories you're burning. We also were sending people to Yale University for magnetic resonance spectroscopy of the liver to measure the liver fat. Now, the participants were losing about 1 pound a week on average. So the total weight loss was about 14 pounds on the vegan diet. And the liver fat content decreased by 34%, which is phenomenal because there is no causal treatment for fatty liver disease. So a reduction by 34% in only 16 weeks is just outstanding. The participants also improved their insulin resistance. Remember how the insulin resistance was one of the factors that diminished the thermic effect of food. So this enabled them to burn more calories. While the thermic effect of food did not change in the control group, on the vegan diet, it increased by 14%. That means that you can eat 14% more calories without gaining weight. Or if you keep your caloric intake the same, you would lose weight because you need 14% less calories. So a plant-based diet really boosts your metabolism. In summary, the important pillars of a diet that boosts your metabolism are: number one, eating early in the day, which aligns the body clock and the clock genes and the circadian rhythms. Number two, eating breakfast like a king, lunch like a prince, and dinner like a pauper, which means that consuming 3 meals a day with no snacks between is better than eating many small meals during the day. And due to increased fat deposition in the evening, dinner should be the lightest meal of the day. And extra points if you can skip dinner completely and eat only 2 meals a day. Number three, eating meals at regular or consistent times is more beneficial compared with irregular or erratic eating habits. And number four, a plant-based diet that emphasizes low-energy foods such as fruits and vegetables and grains and legumes reduces caloric intake and also increases the thermic effect of food and thereby boosts metabolism. So if we practice this vital information, we can all optimize our diet to boost metabolism and win. Thank you for your attention, and I'm ready for your questions.
That was so wonderful, Dr. Hana. I am just so impressed with how opposite our culture follows these daily guidelines, with the snacking consistently and eating dinner as the largest meal and usually skipping breakfast. So many people I know have these very misguided practical habits in their daily lives. So again, I love the practical takeaways. It's so helpful to have some sort of sense of agency and control over our health outcomes and our weight management first and foremost, because that has such an impact on the rest of our health, as we know. So yes, I do have a number of questions and I will try to be as concise as possible. It was really hard for me to choose which ones I wanted to ask you because I have so many. First of all, for anybody who is confused or isn't as familiar, can you just explain what is metabolism?
Metabolism is our ability to take in all the food that we're eating and turn them into our energy. We know that the cells have a powerhouse, which is called mitochondria. And the mitochondria are like a powerhouse of the cell. They just burn the energy. But what happens when our metabolism slows down as we age? The mitochondria are not working that well. They're less in count, they're smaller, and they're also dysfunctional, which is particularly true if people have type 2 diabetes. But can we turn this around? And the encouraging answer is absolutely. We can turn this around. We can speed up the metabolism again, like we were in the 20s.
Great. So people who have been yo-yo dieting their whole lives or fluctuating from a higher weight gain to losing the weight and gaining the weight and losing the weight, you're saying that this is completely overridable?
That's correct.
That's fantastic. Okay, so I was also confused about, is it more beneficial to have a fast metabolism or a slow metabolism? Doesn't a fast metabolism kind of speed up the aging process?
That's a great question. I'm glad you asked. So, with 3/4 of Americans being overweight, I'm guessing that most people will be asking the question, how can I speed up my metabolism? I need to burn more calories. So I was addressing the question for this audience. Whoever needs to lose weight, this is exactly for them. Uh, some people have a great metabolism, they can keep up with their exercise habits and just match the diet that they're eating, and they don't seem to need any special advice. And there's just a small fraction of the population whose metabolism tends to be really fast, and it may be due to many factors. First of all, it may be people who have problems with their thyroid. So, if a fast metabolism is your case, you want to definitely check in with your physician to see if there's any explanation for the super fast metabolism that you're experiencing.
Okay. So I'm still impressed with the ability of intermittent fasting and time restricted eating to boost metabolism. So I've always been told that we go into some kind of starvation mode if we don't eat for long periods of time and then we store more of our energy. So can you kind of elaborate on that common misbelief?
Yeah, thank you for asking. When we start fasting after about 14 hours without food, your immune system gets much more efficient. It triggers autophagy, which means cleaning up. It's like a cleaning crew. Basically, when you're fasting for at least 14 hours, the cleaning crew comes in and cleans everything. Or it's like pruning an apple tree. If there's branches that are uh, dry, that don't produce enough fruit, you just cut them off, and that will enable the branches that are bearing fruit to bear even more, have more energy. And that's exactly what's happening in our immune system when we fast. So fasting is also has been used for people who are on chemotherapy. For example, if you fast for at least a day before chemotherapy and a day after, you lower the risk of the adverse effects of chemotherapy, and you maximize the immune function on the cancer. So it's been shown to really help even in cases like chemotherapy and cancer. So it optimizes the immune system. And now the question is, why is it working for our metabolism? And it looks like the answer is in the flexibility of our metabolism, the metabolic flexibility. When we eat a meal, we want our body to burn carbohydrates as the main fuel, and that's how our body is built. But when we don't have a meal, when we fast, we want our body to switch from carbohydrates to fat as the main fuel. So if we train our body, it will become more metabolically flexible. It will be able to switch between carbohydrates when we eat a meal to fat as the main fuel when we fast.
Very interesting. Thank you, Hannah. Can you describe what circadian rhythms and clock genes are and how they have an impact on meal timing and size? Like you mentioned, eating breakfast like a king, lunch like a prince, and dinner like a pauper, for instance.
Yeah, I'm glad you asked. Circadian rhythms are the rhythms that are roughly 24 hours long, and we have two body clocks. One is in our brain, in our hypothalamus, and that's the central clock, and it's entrained by light and darkness. Uh, the second clock is peripheral clocks, which are in each organ of our body. and the peripheral clock needs to be aligned with the central clock. And this is done by the rhythm of eating and fasting. So if we wake up in the morning and start eating, we tell our body, this is day, I need the body to ramp up its metabolism, will be active. And when you stop eating, ideally before sunset, you signal to your body, it's time for rest. It's time to recover, and I will not need any more activity today. So this is how it works. And the meal timing and frequency play a major role in synchronizing the peripheral and the central clocks.
Okay, so will you explain how evening meals deposit more fat based on these hormone fluctuations that occur during the day?
Yeah, there's many hormones that change their levels during the day. And there are a few factors why this happens. First of all, we tend to be less active after an evening meal. So if you eat the same amount of calories in the morning and in the evening, there's a probability you'll be more active during the day than after your dinner. That's factor number one. But factor number two is really the fluctuations in your hormones. For example, the stress-related hormone cortisol is secreted mostly in the early morning and is declining over the day. So that means in the morning you will be able to burn the calories more efficiently than in the evening. The same is true for insulin action. It's much more effective in the morning compared to the evening. So your blood sugar control will also be better after the morning meal, after breakfast, compared with dinner. So this is a fascinating area of research, and we're learning as the research continues, and it's really wonderful to be able to use all the knowledge to optimize our metabolism.
Yes, you are providing the public with so many tools, and I greatly appreciate it. So, can you tell me what would you feel is the ideal time that we break our fast in the morning? And does it matter what we break our fast with, whether it's like a sweet breakfast or a savory kind of breakfast, vegetables, whole grains, and such?
This is an excellent question. Each one of us has a different schedule, and someone can eat before they leave and can eat at home before they leave for work. Some people need to have their breakfast at work. Both are fine, but generally speaking, the earlier you start eating in the morning, the better. And also the earlier you stop eating in the afternoon or early evening, the better.
Okay, so there's no set time frame for
Exactly.
one person. Okay, just depending on your schedule. Great.
And does it matter what kind of breakfast we eat? Uh, we we discussed what to eat in the last section of the talk. We looked at the benefits of a plant-based diet. So I would highly encourage all of you to give it a try with a healthy, low-fat vegan breakfast. But it can be sweet or it can be savory. It can be oatmeal with blueberries and some nuts and seeds on top, or it can be tofu scrambled with a whole rye toast. So the taste, is it supposed to be sweet or savory? Some people also eat leftovers from lunch or dinner. Some people like soup, or some people even like spaghetti with marinara sauce and basil. Uh, Whatever you choose to eat, as long as it's vegan and low fat, that's the best composition for your weight loss as well.
Great. So I'm glad you brought up the low fat aspect because I noticed that you use that a lot in your research. A lot of people are so concerned about getting enough of these nuts and seeds and avocados and those following a healthful vegan diet. Is it really necessary to acquire these in our diet on a daily basis? And is there other things we can get them from instead that aren't so high in fat?
Uh, when we're on a vegan diet, the main thing to watch out for is the use of oils. because we tend to overdo it with oils, and it's so easy to just pour more oil than you would like, or than what would be good for you. So that's number one. Nuts and seeds are good in moderate consumption, but if you overdo it, again, these are sources of really high quality fats, but it's still fat. And 1 gram of fat contains 9 calories, compared with carbohydrates and protein that contain only 4 calories in 1 gram. So these are really packed with calories, and you need to be careful about the amounts as well.
Okay. So even though they're essential, there are still other ways to get them without including these super high fatty foods in your diet, like the leafy greens and
That's exactly right. Leafy greens, like when you pour water over leafy greens, usually the water will just, will form some drops on the leaves, and that tells you there's some fat in the leaves. That happens, like, for example, if you put oil on your skin and then try to take a shower, the water will just like form some droplets. Or you can do it with your waterproof jacket. There's these special products that will make it even more waterproof, and will keep the moisture off. And so we see the same on the leafy greens, which is fascinating because you wouldn't consider leafy greens as a source of fat, and yet they contain the most healthy fats, the omega-3s. And I wanted to touch on the fat content of the low-fat diet. In our studies, we usually encourage people to limit their fat intake to 30 grams per day. In the fresh produce, it's pretty simple. As long as they don't use oils in their cooking, they don't need to count anything. And except for nuts and avocados, they can have anything from the fresh produce section that they want. If it's beans, if it's grains, no limits. The limits only come into place when it comes to frozen foods or ready to eat meals. When it comes in a package, you want to check the label and make sure that the fat content is up to 2 to 3 grams per serving, so that you will stay in the limit of 30 grams of fat per day max.
Thank you, Hannah. That's super helpful. Okay, so I'm a little confused by one of your research results because, or at least one of the resources that you cited, because you mentioned that breakfast increases the insulin response by like 20%
Mhm.
in one of the studies. So isn't insulin considered the fat storage hormone? And isn't it harmful to have excess insulin and glucose in the blood?
I'm glad you asked. We need to consider that this study was done in people with type 2 diabetes, where their insulin secretion is diminished. So an increase
Ah,
in insulin secretion is a positive finding because that brings down their blood sugar. And so it was a really positive finding for people with type 2 diabetes.
okay, that makes more sense. Thank you for clarifying.
So it brought them closer to what a normal person would experience, a person without diabetes, like a healthy physiologic response.
I just ask because some people are very judicious about including those high glycemic index
Yeah.
foods like the grapes and the white potatoes and such, because insulin is considered this fat storage hormone. And yes, excess insulin and glucose in the blood is harmful, but if everything's working in accordance and properly and we're eating the right foods, do we really have to be concerned about those things?
A high glycemic index is just one of the considerations when we're choosing foods. When it comes to fruit, such as grapes or watermelon, for example, these have a high glycemic index. But when we combine them with other foods that are low in glycemic index, we don't really need to worry about it. So if you're sensitive to the blood sugar fluctuations, you can still include these high glycemic index foods, but just combine them with the ones that are really low in glycemic index.
Okay, that makes sense.
And that's most of the vegetables, almost all the legumes, all your beans and peas and lentils, those are super low in glycemic index. Most of the traditional whole grains, such as millet and buckwheat, those are really low in glycemic index. And it's most of the fruits. There's only a few kinds that are a little bit higher in glycemic index. So as long as you're eating the whole power plate and combine the high glycemic index with the ones that are low in glycemic index, you're completely fine.
Great, because I love my watermelon.
Me too.
As long as it's with the balanced meal, that's good to know. Okay, so I was a little curious about meal duration because a lot of people that I know and that I work with, they eat a lot of raw foods. So is a longer duration of eating considered detrimental by any means, like an hour, hour and a half sometimes?
It's not considered detrimental. Uh, Proper chewing is one of the best ways how to ensure that you feel full. So that's number one. And number two, when it comes to the volume, uh, you said it exactly right. We need a larger volume of raw foods compared with cooked food.
Mm.
And for most people, combining both cooked and raw works best. But if for some reason someone wants to eat only raw foods for a period of time, then that means also a larger volume. And it's not detrimental, it'll just take them more time.
Okay, good.
It may be challenging when combining with physical activity. Like if you're a marathon runner, it may be challenging to consume enough calories that will fuel your runs.
Speaking of exercise, is it more beneficial to exercise fasted in a fasted state?
It depends on what your outcome is. Uh, if you exercise in the morning before you eat a meal, you push your body to use even more fat because you're fasting. Your body is already using fat as the main source of fuel, and you push your body even more to use all the fat as the source of fuel. So to boost your metabolism, this is a really good way. If you're a person with diabetes and your main concern is your blood sugar control after the meals, then short walks after the meals will bring down your blood sugar. So it really depends on what you're trying to achieve. Exercise at any time of the day is wonderful. And if you want to get some extra benefits for your metabolism, then work out in the morning. If you like to optimize your blood sugar control after the meals, walk after each meal, which is a good habit for all of us, even who don't have diabetes. It just brings down your stress levels, improves the digestion, and you feel better.
Would you say that's like a 10-minute walk or closer to maybe a half hour?
10 minutes is enough to experience the benefits.
Oh,
Of
that's great.
course,
I feel like everybody has
exactly.
10 minutes after a meal, right?
Yeah, walk around the block.
I wanted to bounce back to raw foods real quick. So you were mentioning that less processed foods have a higher thermic effect, with heat in the body. Is that even more so with raw foods?
That's a great question, but I'm not aware of any study that would look into it. So we really need to conduct such a study, Karli.
Sounds great. Okay, so is it important to eat at our usual time frame, even if we're not hungry? Is there any validity to intuitive eating?
So having consistent times for the meals is definitely beneficial. If you're not hungry, would you like to skip a meal? Why not? Then you'll get the benefits of intermittent fasting. Absolutely. But it's not a good idea to skip the meal and change your mind like 2 hours later and be like, oh, I am hungry after all. So you know your body the best and what'll work for you. Sometimes you may not feel as hungry, but you feel like, yeah, if I skip the meal, I will be hungry. So let me eat the meal at my usual time, even though it may be a bit smaller than usual. And at other times, you may be like, I can just skip the meal and let me get the benefits of intermittent fasting.
That makes a lot more sense. Thank you, Hannah. Okay. So, in many of your nutrition studies, your participants showed a spontaneous decline in their regular consumption of calories. You've explained that the high fiber content in the plant foods is likely the explanation behind this phenomenon. But can you describe why fiber is so satiating? I remember that you mentioned that they had less hunger on eating less
Yeah.
meals. That's so fascinating. Why is that?
Yeah, it is really fascinating. Uh, the average American population is so fiber deficient.
Mhm.
The recommended fiber intake is at least 30 grams per day, and the average consumption of fiber in the United States is 14 grams per day. So that's not even a half of the recommended value. And once people ramp up their fiber intake, wonders start to happen. Like literally, people are like, I'm full much sooner than I used to. And sometimes we even tease people and we're like, just eat more food so that you don't lose so much weight. And they're like, I can't, I can't.
Mhm.
So this is the wonder of fiber. I'd like all of you to really experience it. Uh, you can introduce the fiber gradually to your diet. Be sure to drink enough water. Be sure to walk after your meals or include some exercise as well. Sometimes people get excited about fiber and just increase the fiber intake and don't drink enough and don't exercise. And this may cause some digestive problems that'll go away, but you don't need to experience it in the first place. You can just do it gradually and drink enough water and also exercise.
Yes, fiber is our friend for sure. So I'll ask you one more question, and I know you got to be on your way. Um, how long should one follow this protocol? Is this lifelong? Do we continue restricting our meals to a point where there's an 18-hour fasting window every day? What do you suggest? What does your research show, rather?
Uh, all these all these are principles that are valid for our lifetime unless the research shows otherwise. So as much as you can stick to all these four principles, the better for you, for your overall health. This is not something that would only be good for a limited period of time. This is something that's for your lifetime.
Thank you for clarifying, Hannah. And I can't tell you how wonderful this presentation has been. You've brought so much value to my viewers and to everybody out there looking for this information. So thank you again for all the hard work you do.
Thank you so much, Karli, and thank you for all your wonderful work, because it's you who brings this information to people who need it most. So I'm grateful for your work as well.
Good. I hope you'll come back because I have many more questions.
Okay, thank you so much, Karli.
All right. Bye, Hannah. Thank you.
Bye.